recording. And I am Shannon Wolford, and I work with Blue Zones Project, which is a health and well-being improvement project that is here in Corry, Pennsylvania. And we really try to coordinate resources for the community. And so we are so excited to have Lana Kunik with us today. The Pennsylvania Diabetes Prevention and Education Program out of the Site Center in Erie was so good enough to say, hey, we'll come to Corry and do an in-person class for the community. And so we are kicking that off in January, but we wanted to spend this time today because it is November and it is Diabetes Awareness Month. We really wanted to raise awareness about this amazing program. And so I'm going to let Lana kind of tell us a little bit about herself and then talk to you about what this CDC program is all about. So Lana, take it away.
Hey, thanks. I am Lana Kunik, and I'm the director of the PA Center's Diabetes Prevention and Education Program. I've worked for the Site Center since 2017, and before that, I worked for the Erie County Diabetes Association, also implementing this evidence-based program that you're going to hear more about today. And I did put together a little slideshow for you so that you don't only have to listen to me yak at you, but you get to look at some pretty pictures as well. I'm very grateful to be able to bring this program to Corry because Corry is one of those areas that, you know, maybe a lot of resources aren't able to get to you in Corry. And that is really part of our mission and our vision is to be able to get out to the more rural areas and support you in any way that you need. So very excited about that. So I'll start the presentation. I know that a lot of questions come about with, okay, so why is there a diabetes prevention program at the Site Center of Northwest Pennsylvania? And I understand the confusion, but just so you know, diabetes is the leading cause of vision loss in the United States. And my program falls under our prevention bucket of services. So in order to prevent diabetes, or by preventing diabetes, you're in turn protecting your eyesight. So that's kind of why that marriage has occurred between the Site Center and our diabetes prevention program. And just so you know, if you have diabetes and you're on this call, or you know someone or love someone with diabetes, it doesn't mean that they will experience vision loss, because controlled blood sugars do help protect your eyes and your organs. But diabetes does lead to several different significant eye conditions such as cataract, open angle glaucoma, diabetic macular edema, retinal detachment, heart and kidney disease, and amputation. And I know that sounds grim, okay? So I wanted to give you the grim part of diabetes before I gave you the silver lining, which is that if you're at risk for diabetes, which we'll talk about what your risk factors are later on in the presentation, that does not mean that you are destined to cross over into that type 2 range. And that's where myself, the Site Center and the DPP and the Blue Zone come in. We want to give you the tools that you need to help prevent this disease, which can really be debilitating if you aren't controlling your blood sugars. So why don't you want diabetes? I just told you the stuff on the last slide about, you know, what it can do to your eyes, but preventing diabetes can also prevent a long list of other serious health problems like heart attack. I don't know if you knew that, but diabetes and heart disease go hand in hand. Stroke, blindness, kidney failure, and loss of toes, feet, or legs. That's serious. And what's really scary is that 88 million people in the United States have prediabetes, and most of them don't know it, because unfortunately, prediabetes really doesn't have any prominent signs or symptoms. So that's what myself and our prevention team do. We go out into the community and we make you aware. If you're not aware, then you don't know to start implementing lifestyle changes that can help you to prevent this disease. So in a program such as the National Diabetes Prevention Program, and just to talk a little bit more about that, you know, if you're not familiar with the program at all, I will tell you this is an evidence-based program. It was authorized by Congress in 2010. It is nationwide, so it's not just the Site Center's Diabetes Prevention Program. It is a national program. We enter all data to the Center for Disease Control, and our site center's DPP has achieved full recognition for, it's called 9 sequences, so for 3 years. And what that means is that we are delivering a quality program that is proven to prevent or delay the onset of type 2 diabetes. Someone that's part of the program, or if you're hearing this and you think, okay, I have no interest in being a part of this program, but I really want to know, what can I do right now to start improving my health? We're going to talk about that. The 2 main umbrella goals of this diabetes prevention program is to achieve, the first goal is to achieve 5 to 7% weight loss of whatever that baseline weight is. So when you come into this program, you're going to be assigned a certified lifestyle coach who will work with you on achieving your goals, your wellness goals. So that's going to be your first goal. So you come in, you have a private weigh-in, whatever that baseline weight is, we'll assign you a 5 to 7% weight loss. Say that's 12 pounds, okay? You're working through the program, you hit that 7%, that 12 pounds, awesome. That 12 pounds, that 7% is enough to bring down your blood pressure, cholesterol, triglycerides, and your blood sugars. So that is why the CDC has approved that weight loss, that modest, in my opinion, achievable weight loss. Once you get there, you can go to your lifestyle coach and you can say, I feel awesome. I want to maintain this. And we'll work with you to maintenance it so that you don't have to lose any more. We can maybe up your calories so that you're able to just stay at that nice 7% weight loss and maintain your wellness. Or you can go up to your lifestyle coach and be like, I feel awesome. I want to keep going. And we will work with you on your own personal goals as long as it is a healthy, sustainable weight loss goal. So that's the first goal, that weight loss, and you achieve that through nutrition guidance. The second goal, which we find to be the most difficult for people, is that 150 minutes of physical activity a week. What that translates to is 30 minutes a day, 5 days a week, and all we ask of you is moderate physical activity, such as walking. But we also know that for some people, walking for 10, 15 minutes straight without stopping isn't doable. I want you to know, if you're considering this program, if you're thinking, oh, my mom or my grandmother might like this program, just know these coaches aren't forcing them to meet that goal. What we do is we want you to be moving more today than you were yesterday. Just small, achievable movements. That could be sitting in a chair, raising your hand above your head. That could be using soup cans to build some bicep muscles. Moving more than you're sitting, that's really what we focus on. But if you are able to hit that 150 minutes per week, that's only going to help with heart health, blood glucose control, and weight loss. How are you going to benefit? I will tell you, I've been doing this for almost a decade. I've been working in diabetes prevention. I myself have struggled with my weight throughout the years. So I am an empathetic coach, and we only hire empathetic coaches. We're an empathetic program. And I really do not like focusing so much on weight, but I want to tell you, that's only a small piece of the program. We weigh you, it takes 5 seconds. We don't ring a bell if you lose weight. We don't scold you if you don't. That is really just so that we have an indicator that it's working or it's not. Here are some things that you are going to experience from the program that might not be that number on the scale. You're going to have techniques to help you identify food cues and reduce stress. I think if I could see your faces and I said, who here eats only when they're hungry? I don't think anybody's going to raise your hand, right? We eat because we're bored, we're stressed, we're mad, we're sad, we're happy. A lot of the reasons we eat are because of cues, not because of actual hunger. By working towards these goals, we're going to be able to increase your energy levels. Fatigue is huge. If you envision your body like a car, I know this is a really nice analogy that everyone uses, and you put garbage fuel in your car is going to run like garbage. And by garbage, I just mean highly processed, wrong portion foods, soda, all that stuff that your body just really isn't happy about if it's coming in at high levels. That is going to decrease your energy levels. Once you start putting that good gas, that good fuel into your cars, like lean meats, complex carbs such as sweet potatoes, rice, your body's going to get happy, and you're going to notice that almost instantly. 2 days of improved eating is going to most likely show you those increased levels that you're not going to want to go without again. You're going to want to continue to feel that energy. You're going to have guidance from a certified life coach and support from your group to keep you on track. So that word group, I will tell you, we offer in-person group setting classes. With what's going on in our world right now, I just want you to know that we follow all CDC guidelines. We have space that is conducive for our class, so you can have that distance. If you feel comfortable with a mask, you can wear a mask. You will be definitely safe within the program due to the protocol that we follow. And we also do offer online classes. And if that's something you want to hear more about, you would just call our office and I would give you more details on our online programming. And with all of this, you are going to decrease the risk of developing type 2 diabetes, heart attack, and stroke by meeting your goals. All right, reading through these bullet points, just in your head, you can think, yep, I need that kind of assistance, or nope, I'm an expert at this. So in this program, you're going to learn how to eat healthy without giving up your favorite foods. If you've ever been on a lifestyle change and you've lost a lot of weight just to gain it back again, I'm willing to guess it's because you deprived yourself to lose that weight. And that's what this program's all about, teaching you how to eat what you like without feeling deprivations, so that it doesn't lead to failure or regain. You're going to learn how to add physical activity to your routine, even if you don't like it. How to cope with stress. We don't just talk a little bit about stress. This program is cognitive restructuring, and your coaches, they're certified to implement this curriculum. So this is tried and true curriculum. This is not any, in my opinion, this is how you cope with stress. This is, science-based approaches that we take, because from what I'm seeing, I've served more than 300 people through this program, just me personally, that's not mentioning my other coaches. And I have seen the most success when people find out what triggers them, what their stress triggers are, and then we work together to come up with an action plan to move around those stress triggers. You're going to learn how to deal with challenges that could derail your hard work and how to get on track if you stray from your plan, because I'm here to tell you are going to stray from your plan. There is no way that you're going to be 100% compliant your whole life. But what we want to do is give you the tools you need that if you do slip, you know how to get back on track. I like to drive this home because it's so important. If you're thinking this sounds good or you want to give it a shot, awesome. But I want you to know this is a commitment. This is a year-long program. When you come into this program, we're starting back at like the grassroots of your behavior, so to speak. We're trying to reverse habits that most likely were developed in childhood. And that isn't a quick fix. So that the commitment of the length of program is extremely important. And I'm just going to give you a brief overview of how that runs. For the first 3 months of class, you're going to meet with your group once a week for 1 hour. We're very specific. We make sure that you are in and out in 1 hour. We don't keep you over. If you want to stay and chat with your coaches, you can, but we value your time. Then months 3 through 6, we meet twice a month. That's called your transition phase. And I like to compare that to like a mama bird, right? So for the first 12 weeks, it's really those core sessions. We're really giving you the tools you need. We're getting those roots into the ground. And then months 3 through 6, we're kind of booting you out of the nest and making sure that you're able to stay on track without being accountable to your coach every week. So we'll be meeting twice a month in that phase. And then the last 6 months of the program, they're once a month meetings just to make sure you're staying on track. And at month 12, you actually have a graduation. Your coaches will provide a dinner for you. You get a certificate because it's not because, oh, you've lost weight and you've increased your exercise. It's because you've completed something big. You have achieved completion of a 12-month national program that is geared towards preventing disease. And that is really something to be proud of. So here's what your coaches are going to count on you to do. Come to sessions and bring your participant notebook. Call or text if you can't come. Like I said, we're empathetic. We understand depression strikes, the winter blues, your kid's sick, whatever, you got a flat tire. We know you're not going to be able to come to every single session, but we just ask that we get the courtesy of a text. Hey, it's Laura. I can't come. My child's home from school. That way, if we're preparing food for you or if we have something special planned, we just know that you're not going to be there. And also, we're worriers. So if it's winter and you don't show up in Corey, we're going to assume you're in a ditch somewhere and we're going to be worried. So just let us know you're coming or not coming. Do your best to reach your eating and activity goals. Here's the thing, keep track of what you eat and drink. And I will tell you, if you're somebody on the call who has tracked your food, you're either going to love it or you're going to hate it. But I will tell you, either way, it's going to be effective. Our biggest, most successful losers track their food the longest, and you're not meant to track forever. It's really just to make you aware of what you're eating, how much of it you're eating, and what kind of ingredients you're putting into your body. We're going to ask you to be honest. So if you tell me, if I'm your coach and you bring in your coach log or your food log, and it says, I had oatmeal and an egg for breakfast, I had a piece of fish and a salad for lunch, and then for dinner, I had a huge chicken salad, and for dessert, I had a veggie and fruit smoothie. And you're eating like this on a consistent basis, but we're not seeing, we're not seeing any improvements in your energy levels, in your outcomes. We're not going to be able to help you. So if you come home and you eat great breakfast, lunch, and dinner, and then in the evening you eat a whole bag of Lay's potato chips, just tell us. I mean, we get it. We've done that. We understand that that happens, but we need to know what your triggers are so we can work together to help you overcome them. And then we do ask that you keep track of your weight and self-monitor at home. So what you can depend on us for, we are going to notice what you're doing well, but we also will let you know what can be improved. You'll never be scolded. If you put on 5 pounds and you come into class, there's never a negative thing that comes from your coaches, negative feedback. We're only going to notice what you're doing right and try to help you improve in areas that you're struggling. We're going to answer questions, share solutions and ideas while learning together. We're going to stand by you during rough times. Another little story is I graduated this year. I graduated my 38th cohort since I began this profession. And there has not been one cohort or one class, I call it a cohort, that I've graduated that I have not cried. And the reason is you become a family. When you're working with someone for a year and you're working on similar goals, you become very much so bonded to that class, which might be something you're looking for. If you're someone that wants to have bonds with people with similar mindsets, this program is a really good opportunity for that. We're going to believe that you can reach your goals and help you achieve them. We're going to support and help you always, share healthy recipes with you. We're going to cook healthy foods for you to try, and we're going to provide you with meal prep ideas. And the last thing is we're always going to remain honest with you. Okay, so on the next few slides, if you're on the call and you're able to see these slides, I understand I can talk to I'm blue in the face about the health outcomes. And for a lot of people, that's enough. The quality of life, being independent for as long as you can, all of those things, preventing disease, they matter. But I also know that we're human, and sometimes to prove that a program works, you just have to show. The proof is in the pudding, right? So, and these next pictures, I put some of our most recent outcomes of people who have met and or exceeded their goals, just so you can get a visual for what the program may hold for you. So we're going to start here on the far left. This gentleman's named Steve. And by the way, we never share your picture, your photo without consent from you. And all of these people have given their consent. Steve is one of our, like I said, I work at the site center. He is one of our visually impaired clients. He is legally blind. He came in here with his blood glucose levels really rising and rising quickly. His cholesterol was through the roof and his blood pressure was through the roof. Within 18 weeks of the program, right around 18 weeks of the program, he was down 60 pounds, which obviously he was extremely happy about. But what was really great is that those numbers, that cholesterol is coming down. Now he's graduated now at this point. His cholesterol has came down, his blood pressure and his blood glucose has entered back into the normal range. This woman in the middle here, she's a school teacher. She put on weight when they went to virtual, because she went from being on her feet, tinkering around all day with her students, to sitting and staring at a computer screen. She was able to have this success of almost 30 pounds throughout the 12 months program. And to this day, she's about 9 months out, 8 or 9 months out of the program, she has still maintained that weight loss. And here on the right, this is Miss Karen. She is the sister of one of our legally blind patients or clients. She just brought her sister as a support. She didn't even want to be in the program. She was just there to quote unquote observe the program and look. I mean, the proof is in the pudding. This was 12 weeks. This is in our core phase. This is 3 months. She was 25 pounds down, went from not exercising at all, any structure exercise, just to a light walk a few days a week. And she used the tools that were given to her to not only meet her 7%, but exceed it. 7% weight loss, but exceed it. Same here, both photos here are 12 weeks difference, and I don't even really need to tell you, just look at them. That's 12 weeks. The woman on the right here is from my Crawford County cohort. She is a grandmother, and her why for joining the program was to be able to keep up with all of her grandkids. And in 12 weeks, she is down 25 pounds. And if you ask me, it's not the weight, her face. She looks so much more joyful and so much more lit up just from having the energy she gets from eating well. Okay, we're almost done here. So what can I do today? How to act to reduce your risk of diabetes today, right now, this moment. You can take a risk assessment, which we'll cover at the very end here. And what that will do is just to let you know, hey, I am at risk and I need to talk to my doctor and see if I should be scheduled for further testing. Number 2, walk. Like I said, just walk. If you're a phone talker and you talk to your daughter or your friends on the phone for a long time, we don't really have cords anymore. Stand up and pace your house. I know you're not going to work up a sweat, but your heart's going to recognize that movement, and you're going to be burning calories and getting that blood flow. So just move your feet, drink water, shoot for 40 ounces a day is what we ask our clients to do. Portion control. Read that food label, and if you're not comfortable with the food label and you decide to join this class, guarantee you when you graduate the class, you're going to be really comfortable with that food label. Increase fruits and veggies. At the end of your day, when you're sitting on your couch, just envision a cup, like a measuring cup. Did I eat 3 cups of vegetables and 2 cups of fruit today? If the answer is no or not even close, that's going to be a really good starting point for you. If you smoke, consider quitting. And if you need help, you can reach out to the site center and we can guide you to where you can go to get that help. All right, so this here on this screen is the ADA's diabetes risk assessment. I'm going to read over the questions very quickly. Here's the questions. How old are you? If you are between 40, and if you're 40 and above, just so you know, age is a non-controllable factor. The older you are, the higher your risk. Are you a man or a woman? If you are a male, males are at higher risk. If you are a woman, have you ever been diagnosed with gestational diabetes? So when you were pregnant, if your doctor told you you had gestational diabetes, your risks are increased. Do you have family history, meaning a mother, father, brother, or sister with diabetes? If so, your risk is increased. Have you ever been diagnosed with high blood pressure? If yes, that's an extra point. How physically active are you? If you think, oh, I'm really physically active, think of what our goal is. Do you think you move, at least get a 30-minute walk in on 5 days a week? That's considered a moderate physical activity. And lastly, there's a weight chart. So I don't know if you are able to see it. It's kind of small here, but what you do is on that left column, you would find your height and then move to the right. If you're in the first range there, your risk is less, but if you are in the middle range or the far right column, your risk is greatly increased. If you take this test and you score 5 or higher, you are at high risk for developing type 2 diabetes. So if hearing, about the program, if you think that's something I would really like to be a part of, I just want you to know that we are offering a session 0 in Corey. It is January 3rd. If you're on the call and you want to attend, please let us know and we'll give you more details on that. If you have a family or friend that you think might be a good fit, please bring them along and you'll be entered in a drawing for a $50 gift card to a grocery store of your choice. And just so you know, if you attend the session 0 on January 3rd, no strings attached. You're just coming to hear more about the program. We'll feed you, you'll get to meet your potential class. And then if you want to move forward with that program, by all means, you're welcome. And lastly, before I give it back to Shannon, I will let you know you've been blessed with a grant from the local health department, the Erie County Health Department, who has agreed to fund this cohort. So typically this program is $500 for the year. This program will be completely covered for you if you join the Corey Blue Zones DPP project.
That's awesome.
Yeah.
All right, I'm going to stop our recording, but I want to say a few words also. And then we want you to